Hey everyone, and welcome back to the channel. Since it's been about a year since Valisure originally released their citizens petition describing the potential for benzoyl peroxide containing products to break down into benzene, I thought it was a good time to look back and review what do we know? What are the knowledge gaps? And what should we be doing right now? Are benzoyl peroxide products safe? And what can we do to make them even safer? So just to review, in March of 2024, Valisure released a citizens petition report where they described that if you expose benzoyl peroxide containing products to heat, that they can break down into benzene. And this is because benzoyl peroxide is an unstable molecule. The reason that it helps to treat things like acne is that it forms oxidative stress and free radicals that kill acne bacteria and help to open up pores. And so this instability is an important part of the effectiveness of benzoyl peroxide. But if taken to an extreme, it has the potential to become benzene. And benzene is a known human carcinogen. It's something that we don't want to have around us as much as possible. So, of course, any finding of benzene in products that we're using to treat acne is potentially worrisome. Now, what specifically did Valisure show in this initial report? Well, when they took a variety of benzoyl peroxide containing products and they heated them to 50 degrees Celsius was their main analysis, and then some others at slightly lower temperatures, that these formed pretty concerning levels of benzene. Now, the challenge here is we know that actually benzoyl peroxide is thermally unstable and can break down to benzene. We've known that for decades. But is this actually clinically relevant with real world use conditions? Is this something that happens substantially faster at elevated temperatures than at lower temperatures? And is this really reflective of stability with real world use? They then followed up that citizens petition with a study looking at a few products, not as many for some reason as in their original study, but looking at a few products at 37 degrees Celsius. And you'll notice first that, well, the y-axis is a lot smaller in scale. So at 37 degrees Celsius, there is much less benzene formation than at 50 degrees Celsius, dramatically less, but still concerning levels of benzene form even at 37 degrees Celsius. Now, this is about 98 degrees Fahrenheit, so most benzoyl peroxide products are not being exposed to these elevated temperatures for prolonged periods of time, but again, an important thing for us to be thinking about. And more recently, Valisure conducted another study where they got 111 benzoyl peroxide containing products just off the shelf, and they tested them for the presence of benzene. And while most of these products had no or minimal benzene in them, there were some products that they detected that had potentially meaningful levels of benzene, even just when they were bought off the shelf. In addition, in this study, they took one of the benzoyl peroxide containing products and they exposed it to 50 degrees Celsius and then to refrigerated conditions and showed that at 50 degrees Celsius, benzene formed. We know that from their prior work. And in refrigerated conditions, it doesn't. They use this to claim that refrigeration is helpful. However, if you want to know if refrigeration is helpful, we should be comparing things to, well, room temperature, right? That's the other condition would be you could store it at room temperature, or you could refrigerate it. If we want to know that refrigeration adds value, we want to compare that to room temperature. And they don't do that. In fact, in all of the work to date that Valisure has done, they've never actually specifically looked at room temperature storage at all. Even this analysis procuring products off the shelf doesn't look at what happens during room temperature storage. It shows that some products do have some detectable levels of benzene when you buy them potentially, but it doesn't show how that benzene formed. In fact, when we reanalyzed Valissure's own data, one of the first things we did was looked at whether expiration dates, sort of as a measure of time on the shelf, correlated with benzene levels in products. And what we found is there is no meaningful association between expiration date, which might correlate with time on the shelf, and benzene levels. So that kind of goes against this benzene forming at room temperature narrative. However, when we look at some formulation characteristics, there's an interesting story that unfolds. If first we just look at washes versus creams, in general, washes have higher levels of benzene in them. In addition, when we sorted products into what we call either hot processing or not, and that would be do the other kind of things in them, the other ingredients really need to be heated to be able to get them mixed together. Products that seem like they might require hot processing were associated with higher levels of benzene. And this really suggests that heat during formulation and production is really important to determining benzene levels in these benzoyl peroxide-containing products because washes are often formulated in larger batches that might take longer to cool and thus might expose benzoyl peroxide to higher temperatures. And of course, products that contain ingredients that are more likely to require hot processing are going to be associated with potentially more temperature exposure during formulation and production. And as we know from Valissure's work, temperature really can accelerate the formation of benzene from benzoyl peroxide. So this, I think, highlights a clear opportunity for us to improve the supply chain when it comes to benzoyl peroxide-containing products. We want to make sure there is as minimal heat in this process as possible. We want to be thoughtful about using ingredients that aren't going to require a lot of heat to get them mixed together. We want to be really thoughtful about making sure that batches are as cool as possible when benzoyl peroxide is added to them and that minimal heat is introduced into the process after that point. We want to be thoughtful during shipping and distribution that products aren't exposed to high temperature variances during that as well. So by being thoughtful about how we formulate, manufacture, and distribute these products, there's likely an opportunity to reduce some of that heterogeneity we're seeing and make all of the products look like those really good ones, which again, most of the products look like the really good ones that have very minimal to no detectable benzene in them. Now, as I mentioned, we want to try to minimize benzene as much as possible, and I think there are strategies that we can think about to help make benzoyl peroxide products safer. However, do we actually need to be worried much about the safety of benzoyl peroxide products right now? Well, first off, benzene is not particularly absorbed through the skin. So the main risk is going to be inhalation. Even though this is a product that we put on our skin, the likelihood that it's going to contribute to skin cancer or things like that is relatively low. The main risk is that it's going to aerosolize and that we might inhale it. In addition, there have been studies that have looked at whether benzoyl peroxide products are associated with skin cancer, and generally have been pretty reassuring. So then let's just try and put this into context. So if we just think about our daily lives, unfortunately, there's benzene in it. We would love, again, for benzene to be as close to zero as possible, but gas stoves, cars, smoking, food, these things all can contribute benzene exposures to our lives. And it's been estimated that people on average end up being exposed to a couple hundred micrograms of benzene every day, just living our regular lives. So let's do a thought experiment. Let's imagine using a 1 gram application of one of the worst benzoyl peroxide products that Valisure identified in their studies. That has 10 parts per million of benzene. That's worse than most of what they tested. This would be a 10 microgram exposure of benzene. And again, as I was saying, assuming even all this benzene gets aerosolized and it gets inhaled by you, it doesn't go other places, it doesn't go outside, all of that, assuming that you managed to consume all of this benzene that was in that application of the benzoyl peroxide product, this is pretty minimal, again, compared to our just average daily exposure of benzene. And it's the unfortunate reality that there is benzene in our world. And as much as we'd like it to be close to zero, this level of benzene from a thought experiment standpoint is probably not going to make a huge difference when it comes to risk of cancer. Now, more recently, this group has looked at affairs, which is a reporting database where people can contribute kind of side effects from treatments and medications, and you can try to use it to understand whether certain medications are more likely to be associated with one side effect than another. This is a very kind of hypothesis generating kind of data set. There's no controlling for different kinds of risk factors or anything like that. It is a really kind of low level, just let's see if there's anything that might stand out that we need to look into further kind of data set. And this group, they went and they looked at fairs and they looked at benzoyl peroxide containing products, notably for the period of 2019 to 2024, and saw whether or not people who are reporting things about these products are reporting kind of a higher percentage of things related to cancer and malignancies than people, other kinds of side effects and other products. And when they did this analysis, they did find that benzoyl peroxide products, especially certain brands, seem to be associated with higher risk of skin malignancies and malignancies in general. However, when we look at these data, we have to pay attention to some features of it. First off, when we're talking about benzene-associated malignancies, the classic ones we think about are leukemias or lymphomas, blood cancers, and also sometimes lung cancer. And when you look in their data, that's not necessarily what they were finding. Again, they were seeing skin cancer and kind of cancer overall, which was largely driven by that. They weren't seeing actually any leukemias or lymphomas at all in this data set. In addition, if you look at the years, there's an interesting thing that happens. 2019 through 2022, there's one reported case of benzoyl peroxide-related neoplasms. Then in 2023 and 2024, there are 22 cases. And if you remember, Valisure released that citizen petition in the beginning of 2024, and there were lawsuits against benzoyl peroxide manufacturers that were submitted really pretty much at the same time, which suggests those lawsuits might have been happening in the background before that. And it's well known that in fairs, there's potential for something called reporting bias, where people end up submitting cases to it because they've heard about something. Sometimes lawyers or other groups encourage consumers to submit cases to this to help support their cases. And that can lead to the data set having a skewed distribution of outcomes. And here you really see this worrisome signal for reporting bias. Again, there's no benzoyl peroxide-related malignancies in the first 4 years they look at, and then 22 in the last 2 years they look at. If in contrast you look at adapalene, their kind of comparator group in these studies, there's a nice more even distribution of reporting of cases across the study period. I would be really curious if you repeated the study from 2017 to 2022, a pretty similar set of years, if you might get a completely different set of conclusions. And that potential lack of sensitivity to simple study design changes really could call into question the robustness of this work. So I would love to see some sensitivity analyses looking at broader years. In fact, there is a study that looks from 2000 and 2024 affairs data looking at benzoyl peroxide, looking more broadly at side effects in general, and they don't see the strong malignancy signal that you see in the study, which again suggests if you looked at a wider or different set of years, you might not get this result, and there's a potential for reporting bias. The final thing about this study is that the odds ratios that are presented are pretty high. Many of these are in the tens or even hundreds or thousands. And if just to put some things in the context, smoking and lung cancer, it would be about a 20-fold increased risk. So to see these really enormous odds ratios starts to raise some questions about the validity of the data. I mean, for instance, smoking is associated with about 2 milligrams of benzene exposure a day. And again, we're talking with benzoyl peroxide potentially on the order of micrograms. So orders of magnitude less benzene, and yet potentially we're seeing malignancy signals that are orders of magnitude more than something like smoking. So that again starts to call into question potentially the validity of these results. And again, I think doing some basic sensitivity analyses is really important here to see whether these are robust to controlling for potential issues of reporting bias, which could again really skew these results. Now, what other data do we have about the real world risks of benzoyl peroxide containing products? So this is a study looking at NHANES data. So these are data collected just kind of generally about medicines people are using, other health characteristics. And what we tried to do in the study is find people who are using benzoyl peroxide products, compare them to people who were not, try to match them as well as we could on any factors that we could, their age, their sex, socio-demographic factors, et cetera, and then see, are the people who are using benzoyl peroxide containing products more likely to have detectable levels of benzene in their body? And what we find in the study is there are no differences in benzene levels or detectable benzene between those who are using benzoyl peroxide containing products and those who are not. Now, this study certainly has its own limitations. We don't know how much benzoyl peroxide containing products people are using. The sample size is relatively small. But this is reassuring. Things we care about. Are people having increased levels of benzene? These data seem to suggest no. And then the other thing, of course, we care about is cancer. So we talked about using FAIRS, which is a reporting database way to look at that. Often a more rigorous study design that people consider would be a cohort study design, where we take a group of people who are using benzoyl peroxide containing products, and we try to match them with a set of control people so we can adjust for potential confounding factors and other sources of bias that might influence in the results. So this is a study using TriNetX. It's about 27,000 people who are using benzoyl peroxide containing products compared to similar number of people who aren't. Looking at 10-year outcomes of cancer risk, trying again to control and match on every kind of demographic variable that might be relevant that we can, so age, sex, smoking, et cetera. And when we do this analysis, we don't see any evidence of increased risk of lymphoma, leukemia, malignancies in general among those who are using benzoyl peroxide containing products compared to that control group. So again, these are relatively reassuring data. Now, of course, this also has limitations. We don't know, again, how much benzoyl peroxide exposure people are having. We don't know what products they're using. Maybe some products might be more worrisome than others, and we're not able to look at that kind of granularity in this type of analysis. But again, it seems like for the average user of the average benzoyl peroxide containing product, there's not a clear signal for risk here. We also did another sensitivity analysis comparing to a different group of warts and found very similar findings. So what are the current takeaways that I would say for someone right now in 2025, a year after that initial report? Well, first, we definitely need more data to understand this. A lot of the data we have right now is limited in a variety of ways that I went through in this presentation. So prospective studies looking at routine use of benzoyl peroxide products, looking at risk of benzene in the blood or other areas of the body, looking at long-term outcomes like cancer. We definitely need to generate those data so we can really answer this question. There are obviously, I think, opportunities for us to improve the supply chain to make things as safe as possible. But right now, when you really just do the thought experiments or look at the high quality data, Even if there is a little bit of benzene present in benzoyl peroxide containing products, this exposure doesn't appear to be a clinically meaningful risk compared to other exposures in our daily life. It doesn't appear to be associated with increased risk of detectable benzene in people or increased risk of malignancies. We definitely, again, want to try to make benzoyl peroxide products even safer. We want to make that benzene as close to zero as possible by improving our supply chains, by thinking about how we can minimize heat during that process. If you're a consumer, we want to be thoughtful about not exposing benzoyl peroxide containing products to heat, discarding products that are exposed to heat or that are old and expired. And then the fact of the matter is, benzoyl peroxide is a treatment that doesn't have any clear alternative. It's also critical to prevent antibiotic resistance when we're using things like topical antibiotics. In fact, in the American Academy of Dermatology guidelines, we don't recommend topical antibiotic monotherapy without benzoyl peroxide containing products. So if we don't use benzoyl peroxide, that means we're also not going to be using topical antibiotics. That leaves us with very few topical options to treat acne. We have topical retinoids, topical anti-androgens, which can be expensive and hard to access, salicylic acid and azelaic acid being the main treatment modalities that we can use. And unfortunately, many of these treatments are not going to be enough without other things to get people to their treatment goals. So if we don't have benzoyl peroxide and we don't have topical antibiotics, more people are going to need to go on to other systemic acne treatments like oral antibiotics, which have been associated with breast and colon cancer, like spironolactone, which has had its own cancer risk, which in general, the data has been reassuring, but still been a question in the community. And then medicines like isotretinoin, which of course are associated with a lot of potential side effects. So it's not just a question of benzoyl peroxide or not. It's a question of benzoyl peroxide or what else. And sometimes that what else might be more worrisome from a cancer standpoint than benzoyl peroxide. So again, this is an important issue. We want to make the supply chain as safe as possible. And I think we have opportunities to improve that. But right now, it really does seem like the average benzoyl peroxide product used in the average way is not associated with meaningful clinical risk of worrisome outcomes like cancer. I certainly think we can continue to use these products safer. Again, it doesn't mean we don't want to try to make them even safer than they are, but I don't think we need to stop using these products. I think there's something that we can continue to use when used thoughtfully. And I look forward to kind of seeing more data as it comes out to inform our decision making. I think it'll be great if the FDA weighs in on this so that we can get their thoughts as well. And I think this is an opportunity for us really to think about this product type of benzoyl peroxide containing products, how to make it as safe as possible, and to really, in general, I think, consider the situation as largely, I'd say, reassuring. So thanks again for listening. If you found this video helpful, please give it a like and subscribe to the channel. Your support really means a lot. And until next time, see ya.